There's this condition that affects a huge chunk of the world's population, maybe up to 8%. But for so many people, it's still a complete mystery. We're talking about fibromyalgia. For the people who live with it, it is a daily, invisible battle. Okay, so let's dive into this and really try to get what's going on here.
And right off the bat, check out this number, 3 to 1. That's the ratio of women to men who get diagnosed with fibromyalgia. For every one man, there are 3 women. Now, that alone raises a huge question, right? Why? It's a really key piece of this whole puzzle.
So we know it's common, and we know it affects way more women than men. But what is it? What is fibromyalgia really? It gets dismissed so often, or people just don't get it. So right now, we're going to pull back the curtain on this thing, using some of the latest research to guide us.
Okay, first things first, let's get a really clear foundation. Because, anyone who is living with this will tell you it is so much more than just feeling tired or having a few random aches. No way. This is a systemic, life-changing condition.
So here's the official clinical definition. And I want you to notice, it's not just about pain. It's a syndrome, right? Which means it's this whole cluster of issues that show up together. You've got the chronic widespread pain, of course, but then there's this bone-deep fatigue, sleep that never feels refreshing, and some serious cognitive and mood challenges. It is absolutely a multi-front battle. And yeah, the list just keeps going. The thing that's so wild about this is just how varied all these symptoms are. You've got the famous fibrofog, that frustrating mental cloud where you can't find a word or remember what you were just doing. But then you also have migraines, gut problems, and intense morning stiffness. You can see why this makes fibromyalgia so incredibly tough to nail down and to manage.
So why? Why does all this happen? Well, to really get fibromyalgia, you have to look at the central nervous system. And here's the thing. It isn't a problem with the muscles or the joints themselves. Nope. The problem is in how the brain and the spinal cord are processing pain signals.
The key concept, the big idea, is something called central sensitization, and this analogy just explains it perfectly. Think of your body as having a volume knob for pain. Well, in someone with fibromyalgia, that knob is cranked all the way up to 11 and it's stuck there. So what happens? A light touch, something that shouldn't hurt at all, can feel painful, and things that are maybe a little painful become absolutely agonizing. The whole system is on high alert. So what's cranking up that volume knob? Well, it boils down to a chemical imbalance in your nervous system. Think of it like a car. In fibromyalgia, the gas pedal is floored. You've got way too many of these chemicals that are basically screaming pain and just ramping everything up. And at the exact same time, the brake pedal is failing. There aren't enough chemicals to say, whoa, calm down. It's a total runaway system.
And listen, this is not just some theory. This quote, right from the research, brings it home with cold, hard data. The levels of something called substance P, that's one of those gas pedal chemicals, are 2 to 3 times higher in the spinal fluid of fibromyalgia patients. That is a real, measurable, biological difference that explains why the pain is so amplified.
Okay, so if there's no simple blood test or x-ray for this, how on earth do doctors figure it out? Well, the process for getting a diagnosis has actually changed a lot over the years. It's moved away from just a physical exam to something that's way more holistic, something that looks at the patient's whole experience.
But first, let's clear something up really quick, because this gets confused all the time. You've probably heard of tender points. It is so important to know they are not the same as trigger points. As you can see here, tender points in fibromyalgia are these widespread, symmetrical spots that are just super sensitive to touch. Trigger points, on the other hand, are those tight, ropey knots in a muscle that can send pain to other places. Telling them apart is absolutely key to getting the right diagnosis. And the whole role of those tender points has changed. So back in 1990, a doctor would diagnose you based on finding pain in at least 11 out of 18 specific spots. But then by 2010, the thinking started to shift. The focus moved away from that physical exam and more towards what the patient was reporting, using things like a widespread pain index. And then the 2016 update refined it even more, looking at how many areas of the body are in pain and the severity of all those other symptoms. It just gives a much fuller picture of the illness.
So once that diagnosis is made, what's next? What do you do? Well, the good news is our whole approach to treatment has gotten so much smarter. It's not about searching for one single magic bullet anymore. It's about building a strategic, personalized game plan.
All right, and this right here is maybe the most important takeaway. The goal is management. Since fibromyalgia shows up so differently in everyone, a one-size-fits-all approach is just not going to work. An effective treatment has to be holistic, combining a bunch of different strategies, and, most importantly, it has to be built around what that specific person is going through and what their goals are.
Now, medication can definitely be part of that plan. For instance, this chart shows how effective pregabalin can be. It's an anticonvulsant that's approved for fibromyalgia, and you can literally see it right here on the chart. As the dose goes up from 300 to 600 milligrams a day, the bars get taller. That means more and more patients are getting significant pain relief. This is just one of several types of drugs that can help kind of rebalance those gas and brake pedals in the nervous system.
But, and this is a big but, medication is only one tool in the toolbox. This is where the strategy gets much bigger. These non-drug therapies are just as important, if not sometimes more so. Just understanding the condition is the foundation. Gentle exercise, actually one of the most effective treatments out there. And then you have things like cognitive behavioral therapy, mindfulness, even acupuncture. These can be powerful, powerful ways to manage symptoms and just get your quality of life back.
And all of this brings us to our final point, and honestly, it might be the most important one. When you're managing a condition that nobody else can see, it comes with its own set of challenges. And the solution? Well, it often starts with something incredibly simple. I mean, this quote from the source material just says it all, doesn't it? The relationship between a doctor and a patient is everything. When someone with fibromyalgia feels heard, when they feel believed and supported, their ability to actually stick with a really tough treatment plan just skyrockets. Validation isn't just a nice-to-have, it's a clinical tool. And that kind of leaves us with this final thought to chew on. Fibromyalgia is an illness of amplified pain signals in the nervous system. But maybe, just maybe, the most powerful way to start turning down that volume doesn't begin with a prescription pad. Maybe it starts with empathy, with validation, and with the simple act of truly listening.